I want to give you the reassurance that you can also do well in the exam, no matter what the topic. So these are some examples actually of what I thought of might be difficult topics for you in your exam. So we've got some examples here of conditions that you haven't seen or heard of before. And maybe if that was your exam day question for the speaking subtest, you might be looking for some language to use, maybe not so sure about how you would approach this topic. So what do you think? Are any of these new conditions for you? Are any of these things that you haven't had a patient with before? Hazim, what about you? Or Rainy or Awad? Have you treated patients with these conditions? Have you come across this in your work out, speaking in your own language with patients with any of these conditions? Mustafa, Faren, what about your experience? So these are things that if it was exam day, maybe a pilonidal sinus or cyst you'd be thinking, oh, I don't really know. I've never had a patient with that condition. Or hereditary hemochromatosis, perhaps you would not be sure how that is diagnosed. Or hairy cell leukemia, maybe you're not sure about what the prognosis is for patients with those conditions. Well, it doesn't matter. I'm assessed on your medical knowledge in the OET speaking subtest. That's my question for you. Is it your medical knowledge that is assessed? Well, let's take a look at the assessment criteria. So what are some of the things that are assessed? We've got two different categories of criteria here. We've got the English language linguistic skills, and then we've got your clinical communication criteria. So what I'm looking for here is which of these things are assessing your medical knowledge, if any? Intelligibility, well, that's not your medical knowledge, right? Your fluency, that is certainly not an assessment of your medical knowledge. So how well you can speak English at a good pace. Using minimal fillers, that's the R's and the sounds that we use when we're thinking. Your appropriateness of language, so not using technical terms. So if anything, that's not about your medical knowledge, because you've got to speak in words, in layman terms, in the words that the everyday person can understand. Your ability to use good grammar and good vocabulary, perhaps with phrasal verbs and idioms, which is going to be my focus today, to give you some examples of how you can use this and show these skills to the examiners. Your relationship building. So making sure you try to use the patient's name, not just at the beginning, but maybe throughout the role play. Be respectful at all times, and show empathy when necessary. Are any of these things so far assessing your medical knowledge? What do you think? Make sure that you're listening to the patient, you're understanding what they tell you and incorporating that into the role play. You're giving a good indication of what you're going to talk about next. You're giving structure and making any topic changes obvious. This type of thing, that's definitely not assessing your medical knowledge. When you're gathering information from the patient, is that assessing your medical knowledge? maybe you've got a structure that you follow when you're, when you want to talk about, when you want to find out about a patient's pain level or what's happening with their migraines. You've got to ask certain questions, but it's still not really your medical knowledge that you're using here to find out more. And giving information, well, is that your medical knowledge? It could be, right? What do you think? Hmm. So I think that information giving is probably the one that most students think, yeah, okay, I've got to know about the pilonidal sinus or the hereditary hemochromatosis to be able to give that information to the patient. But it's really how you use the roll card in front of you on exam day that's assessed, not what knowledge or experience you've got treating these conditions already. So it's going to be about the way that you use those clinical communication skills, the way you communicate with the patient in English that is assessed. So what's an example of a medical condition that perhaps you don't know a lot about? The Buruli ulcer. What do you know about this? So Mohammed, I know that you're wanting some reading help. We're focusing on speaking today. Perhaps you can take a look at our website for more about the reading part A. But what I want to know right now is, have you heard of Buruli ulcer? Well, it's okay if you don't know, because this is an assessment of your English language skills. And it's, it's important that you are able to have a successful conversation with the patient about it. And if you don't know about it, it's actually okay. You can still perform well with if you've got really good communication skills, if you're speaking well in English, then that's the main thing that you have to do here. So my tips for you are basically this. If it's exam day and you've got a medical condition that you don't know anything about, you have to imagine that you're the world expert on that condition for the 5 minutes of the role play. So you imagine that you're in your professional clothes, you're at work, and you've maybe got your stethoscope around your neck and a white coat on if that's what you wear at work. And you, for those 5 minutes, are the world expert on Buruli ulcer. This is going to give you the confidence to speak with your patient who has come to you into that exam room for your help. Now, in the real world, you wouldn't do this. You would, you'd use the internet, you'd use some reference books. Maybe while you're talking to your patient, you're looking up something on the computer about this. And you find the information. You can't do that in the exam room. So you're the world expert and you're going to talk about it using your roll card. Mozit, thank you for your question. Can you make something up if you need a few more sentences than what's written on the roll card? Well, your medical knowledge is not assessed. So if you wanted to add something, for example, to reassure your patient, you could, as long as I guess this made up information is related to the words that you're given on the roll card and you understand what those words mean and you're just perhaps expanding a little bit on it. I wouldn't invent information just for the sake of, continuing the story. remember in that role play, we've got all these other things that we have to do, like responding to what the patient tells you. You've got to make sure that you answer their questions and you reassure and you explain, but perhaps you know more about the treatment than you do about how it's actually diagnosed or tested for. And you've got organizational phrases that you're using. So for example, look, we're talking about how we test for this condition. Now I'd like to move on and talk to you about what treatment we can offer you and how that treatment works. So yes, look, if you don't know for certain about something, you don't have to be 100% accurate with your knowledge here. So there are all these other words that you're going to use in the 5 minutes of your role play, like encouraging the patient to tell you as they think of things. They can interrupt you at any time, and also ask you a lot of questions, let them know that it's okay to do that. This type of language will take up some of the role play as well. Okay, so let's imagine that we're doing this role play now. We've got some preparation time before it starts, before our 5-minute time speaking role play starts. So let's think about how we would begin this role play. If you have any ideas, please let me know. And we're thinking about the type of patient as well. So in this case, we're using information given here. We know that this patient has this lesion or mark on their shin. It's not healing, and they're concerned and anxious about that. So we're going to be able to reassure them all the way through the role play about that, when it says to reassure, but also at other times. If we notice that they're worried, we can reassure them. So let's think about how we might begin this role play. And basically, to do this, we're going to introduce ourselves. Notice that this card, I haven't specified a setting, but we might use that to introduce ourselves. We might use a bit of a general talking point. We know about this spot or mark or lesion on their skin. Good to start with an open question. The next thing I want you to think about in this 3-minute preparation time is what you can translate. So if we think about those assessment criteria that we talked about earlier, we've got to show appropriateness of language, professional, and using appropriate language, so everyday language. So nothing too technical. What words are already on this role card that we can explain to the patient? So that's showing your language skills to the assessors as well. So for example, these are some ideas of things that you can try to explain to the patient. Try to avoid using highly technical words. Imagine that your patient has a lower level of education, so they're not fluent in medical English like you are. The other thing that's important in this preparation time is think about how you will say the words that are in brackets on the card. I find that these words are often technical words. We're not going to read them out like a list. Try to paraphrase, put them into your own words. Important. A lot of students make a mistake here when they see the words in brackets. You don't even have to use them. Maybe you've got other ideas and you want to do it differently. That's okay. And Mozzie had this question about, can we make something up? Well, maybe you want to use your own ideas for these points in brackets. So my overall tip here is you've got a card, a roll card. It's about a condition you know nothing about. If you get really nervous, use the words on the card. If you get stuck, it's better than saying nothing. So that's the basic level of English. Next would be to paraphrase, to move the words around into a different order. But the best thing is, of course, if you can completely use your own words, use synonyms. But on exam day, it's common to get stuck and nervous. I got stuck and nervous at the start today because the sound wasn't working properly. And I straight away focus on what's written to help me get through that patch. So you would do that too. You would work through the tasks in order, hopefully still using phrases that help give good structure to the role play and empathizing where necessary. But if you really can't think of other words to get through it, use the role play to guide you. Use those words until you get the confidence and the ability to put things into your own words. So how do we do that? How do we put things into our own words? It helps if we have a really good and wide and varied vocabulary to draw from. So yeah, well, maybe you know the meaning of some of these words. So let's work through them. I've already talked about the first one, a lesion. That's a technical one. These technical words are fine for your writing, for your formal letters. But if you're speaking with a patient, let's try and use some everyday words, because your patient will be more likely to understand what you're saying if you use words like a spot, a mark, a sore. We have many different words that mean the same thing in English. Investigate other possible diagnoses. Again, sounds like you're writing to another healthcare professional with those words. So how could we use more everyday language? Well, words like run some tests to check what's causing it. That would be more appropriate there. I'll give you some time to think through these other things. Please feel free to tell me in the, send me a message and let me know what your other ideas here are here to put these into everyday words. So Mozid or Milika, Hazim, Mustafa, maybe you can tell me what your ideas are for these technical words. Exclude other possible diagnoses. We're going to use an expression like rule out other medical conditions. Great, thanks Mozid. You got rule out there. So fantastic. Confirm presence of Mycobacterium ulcerans infection. So we can change that, make it sound simpler. Basal cell carcinoma, perhaps we'll just explain that as the most common but least dangerous cancer, or it's a common type of skin cancer. The test has high accuracy. Okay. This test is very accurate. And it will let us know for sure if it is Buruli ulcer or not. Mosquitoes appear to be involved in transmission. Okay. Mosquitoes, do you have a name, a common name that you use instead of mosquitoes? What do you call them in your language? So how would you say this? Mosquitoes appear to be involved in transmission. This is straight out of a textbook definition, actually. How can we put that into words that we would use when we're speaking with the patient? I'll get you to tell me your ideas on those. All right, so any ideas, please share. Common name that you use instead of mosquitoes, what do you? You get it from mosquito bites, mozzie, that's correct. So get is a common word that we can use in these role plays. You get it from mosquito bites, mozzie, that's correct. So get is a common word that we can use in these role plays. You get it from mosquito bites. Maria, also still a little technical. So remember, we're looking for the way the patient speaks. Maria, also still a little technical. So remember, we're looking for the way the patient speaks. Any ideas? All right. So you probably catch it from a mosquito bite or a mozzie bite. So we can use this word mozzies. Has anyone heard of that? A name, a common bugs name that you use instead Thanks, of Ron. Mosquito. Use this word mozzies. Has anyone heard of that? A name. All right, and the last one, the infecting organism. That's a nice explanation. I believe that there are some sort of bugs which have a role in spreading this condition. Nice. So the infecting organism, any ideas what we could say in place of those words? The microbe, the bug, or the germ. Okay. These are the types of words that we're trying to use instead. Okay, so the next thing we're going to think about is how we're going to start the role play. Maybe you've got a favorite way that you use to introduce yourself. It's always good to say what your role is. I'm the nurse on duty today. I'm one of the nurses working here in this clinic. And use your name. The icebreaker, this idea is what we're going to say when the next thing that we say to the patient. So try to use some of your background information here. I think this is a really nice idea to use the background. So one piece of information you're going to take from the background at the top of your roll card when you start talking to your patient. And then plan your open question. Your icebreaker might be to comment on why they've come. So maybe you can even see the spot on their shin when they walk in the room. So open question, and a nice open question to start the role play, and look how first task point is find out about their skin symptoms. So we want a general, a work question, a who, what, where, when, why, or how question to begin to get the patient talking. You might like to use tell me in your own words, for example. So what kind of open question could you use here? Can you tell me in your own words how this came about? Then we're going to listen to their answer and fill in the gaps. So we want to find out as much as possible here, perhaps about the initial appearance of the skin symptoms, how it developed, what was the time frame, other things happening like an itch. So your questions could be based on these words in brackets. Try not to use the exact words in brackets. We're using them as an idea to help us remember. Answer and fill in. Okay, let's talk about phrasal verbs. Now, phrasal verbs we tend not to use so much in the letter, in the OET subtest writing, if we're writing to colleagues, because the phrasal verbs are less formal usually. So what I'd like to do is work through these formal expressions, and if you can tell me a phrasal verb that could be used to say this phrase on the left-hand side. For example, explain to me the development. Instead, we could say, tell me how it came on, or tell me how it came about. What about the next one? Other possible diagnoses can be investigated. Well, we've already had a look at that one. So rule out could be the way there. Mozzie gave us that answer there. Treatment is more effective. Do you know a phrasal verb that could be used here? Clear up. So if the treatment is effective, the treatment clears it up. Antibiotics used to treat this infection are very effective. Once the antibiotics kick in, you will notice a big improvement. Last one, involved in transmission. Oh, thanks, Mohammed. So using antibiotics will pay off in the long run, for example. Thanks, Mohammed. What about involved in transmission? Can you think of a phrasal verb that we use when we talk about transmission? Perhaps we've looked at transmission on the previous slide. So maybe I mentioned a phrasal verb there already. Can you think what you could use here? when you're explaining to the patient that outbreaks tend to involve mosquitoes in the transmission of Buruli ulcer infections. Pass on. So to transmit or pass on. Spread, we could use a leader as well. So that's the nice everyday way to say it. Okay, now to my favorite part, idioms. For those of you who've watched my speaking lectures before, you'll know that I'm a big fan of using idioms. I encourage students every week to use idioms because I believe that this is showing a higher level of your knowledge of using English language. And it's just the way the patient speaks. Now you'll hear about idioms in listening part A. You'll hear the patient using them. You'll probably hear the doctor or the healthcare professional use them as well when they're speaking with the patient. So I think that it's something that's good to try out while you're practicing, and keep on developing this skill. As you keep developing your English language skills. Understanding idioms and using them as well is a really good thing to try out. So I want to encourage everyone to do it. Now, maybe there's an idiom that you like to use. Maybe there's one that you're already trying or you're already using it in your role plays. Could you let me know what idioms have you used or have you heard other people using in these conversations? There are some simple ones and there are some more complex ones. I'm going to give you two today that we'll look at here. One's a simple one and one's a little bit more, I guess, a bit more of a challenge to use. I know some students like using in a nutshell. So in a nutshell, Buruli ulcer is a skin infection. We think that it's transmitted by mosquitoes. So that one's a common one actually with students, with candidates. Is there something that you're trying out? Okay, so antibiotics, very effective. We talked about when the antibiotics kick in, you'll be okay. So that's the phrasal verb. But what about with an idiom? Once the antibiotics kick in, you will be on the mend in no time. Another opportunity for an idiom here. Thanks, Mozid, you got it. So another example, another opportunity. Thanks, Paul. To put things in a nutshell, it's a nice way to give a very brief, simple explanation. So nobody knows for sure about this mechanism. I guess it's one of the reasons I chose Buruli ulcer. It's been in the news over the last, I don't know, 5 years here in Australia, particularly in the southern parts of Australia in Melbourne. Nobody knows yet for sure. We don't fully understand the transmission. So we might say the jury is still out on that. Mohammed, out of the woods. That's a good idiom for using in a lot of different role plays. So this patient, you're not out of the woods yet, but with some treatment and a proper diagnosis, you'll be on the mend in no time. So we're going to focus now on this expression, the jury's still out on that. I've heard of this one before. This is what it means. So the literal meaning, a jury, we're talking about a court or a legal situation. And we can apply it though. It's not it has an idiomatic meaning. We don't only think of this literal meaning with idioms. So we don't only have to use it in a court or legal setting. We can use it in other settings when we're talking to the patient. Anytime people don't know the exact answer, we don't know for sure. So we could think of it this way. I'm having a conversation with my friend about Wimbledon or the US Open. Who's going to win? Well, the jury's still out on that. Who's going to win the tennis, the women's tennis finals at the Tokyo Olympics? The jury's still out on that. Maybe it will be Ash Barty. It depends who is fittest on the day. We just don't know yet. Applications. The wider scientific or medical community are uncertain. Now, I've thought of some other examples. E-cigarettes or vaping. Is that safe? How does that compare with smoking cigarettes with nicotine? Is the jury still out on that? What do you think? Or long COVID? What are the long-term effects of COVID in a patient? Someone who has contracted it, what are the long-term effects? Do we know yet? No, I think maybe the jury's still out on that one as well. Phrases that might go along with it, the things like nobody knows for certain, but it's worth giving this treatment a go. If we don't know yet about the, for example, the new clinical trial drug. So I'd like you to have a go at how to respond to this patient. Try to use the jury still out. Try to use this idiom in your answer. Your patient says to you, doctor, I've been trying to understand how I got this infection in the first place. I want to be certain that I don't get it again. And I also don't want any of my family to get it either. What can I do to be 100% sure this won't happen? How would you respond? Please tell me your ideas. What would you say? Given the information on your roll card, remember we can't Google Buruli ulcer in the exam room. How would you respond using this information on your roll card and the language that you already know? While you're telling me your ideas, I'll share mine with you. I always like to use the patient's name here. John, I understand your concern here because if left untreated, this infection can lead to real problems. It's not easy when we don't know the exact cause or the exact way you came to have this skin problem. In fact, the jury's still out on the science behind all of this. And then what we do know is that mosquitoes appear to be a part of how this condition is passed on from person to person. So that would be my way of using the idiomatic expression. So just by way of reassuring you, I don't want you to be worried about getting into the exam room and having a medical condition that you don't know anything about. Yes, it's difficult if your exam is like this, discuss M. ulcerans. But that's more likely the way you're assessed at university, or if it's an assessment of your medical knowledge. Even discuss Buruli ulcer, Mycobacterium ulcerans infection. So that is relying on what you know about the condition already. But in the OET exam, you're given all these other words, all of this other information to help you. Use the role play card to guide you. You have that role card in front of you the whole time during your exam. And yes, you can look down at it during this time, the 5 minutes of your role play. It stays there with you. It's yours for the time that you're in that exam room. You can make notes on it. You can circle and highlight things on it. So I don't want you to worry about what if I get in the exam room and I'm not confident because I don't know about Buruli ulcer, hereditary hemochromatosis, pilonidal sinus. I've never had patients with these conditions before. It's okay. You can use the information. All those other words on the roll card are there to help you. And there's all these other things that are being assessed, like the way you use everyday words like phrasal verbs and idiomatic expressions, like the way you use organizing phrases to tell the patient what you're going to talk about next, or the way you do your summary at the end and encourage them to ask you questions. So you can feel confident. For the 5 minutes of your exam, you are the expert on Buruli ulcer. And that patient sitting opposite you who is the interlocutor, they're an actor playing the role of the patient. They've come to you to listen to you and to get some help. So they will believe that you are the world expert on Buruli ulcer. They don't know any different. And they're there to help create a conversation that uses your English language skills and your communication skills. So I'd like you to ask questions now about the speaking. Maybe there's something that you're not really sure about. Maybe you need some more explanation about something from my role play or about idioms or anything else about the speaking exam. And while you're asking questions, I'm just going to let you know, if you're interested in this topic of Buruli ulcer, maybe you want to go and use this idea for other speaking, other OET subtest practice. For example, if you want to practice listening, there's a really great interview on the ABC, that's the Australian Broadcasting Commission. Maybe you need some practice listening to the Aussie accent. You can listen to an interview with patients. So it's a bit like listening part A. And there's also an interview in that same listening with an infectious disease specialist, Professor Paul Johnson. And that's a little bit like perhaps listening part C or listening part B. So you can listen, there is some more information about this medical condition, as I said, and you can read about it also. So this is a great website for practicing these listening and reading skills. Maybe you want to practice your writing skills. Well, you can imagine that you're referring the patient from the listening to the doctor in the listening. You could do that. You could refer John to Professor Paul Johnson. If you'd like some speaking private tutorials from myself or any of the other OET online tutors, then we have packages here where you can do a platinum speaking course or a standard speaking course, depending on how many private lessons you think you need. We've got live lectures, 2 different speaking lectures every week. We've got the student forum. You can find a speaking partner there. So maybe you want to find somebody to practice your role plays with. And I recommend everyone practice with a speaking partner. Even better if they understand the assessment criteria and they are also preparing for the exam. We've got some great options there for some extra lessons. We've had some students do well in their exams, so you can see these results. Shows that we can provide you with some assistance to get through. So if anyone has a question, what is the best way to start? In particular, breaking bad news. So my main suggestion with breaking bad news is that we're going to give small explanations and we're going to check in often. Starting that is, it's important to use appropriate intonation, the way you use your voice. The tendency is for your intonation to go down at the end of the sentence when you're delivering bad news. We're not excited and happy with rising intonation. So we're using our voice appropriately, maybe speaking a little more slowly and softer to break the bad news. But smaller pieces of or chunks of information are good, and keep on checking. How do you feel about that is a really good question to ask someone when you're delivering that kind of news, Hope. We have some other questions, Paul. Paul, yes, you're wearing a uniform, but it's always good to say that you're who you are. There's many people walking around in a hospital, and perhaps all the medical staff, the doctors and nurses, are wearing scrubs. So we tend not to wear white coats here in Australia, actually. So it's not obvious for patients who the doctors are and who the nurses are. And Diana? Oh, Diana, that's a very specific question, and you're going to have to check with your registering authority about that for midwives. So I think it depends on the country where you did your initial qualification and the country where you are hoping to register. So, oh, actually with the OET exam, I believe that you can do either. Like I could do the medical exam, for example, whichever you feel you can do the best in for speaking and writing, Diana. but there may also be some registering criteria there too. We're about to finish. Thank you for joining. I apologize for the technical sound difficulties at the start today, but I hope you all gained something from my thoughts and ideas and my encouragement about the OET speaking subtest. All the best with your preparation. And I hope that you all can speak more confidently now about unfamiliar medical conditions. So all the best with your preparation. Thank you. Thank you for joining. Bye. Thank you very much. You're all very welcome, and I hope to see you again. All the best with your preparation. So please join me. I'll be back in about 2 months' time, so I hope to see you all then. Maybe in the meantime, come and join us at OET online.